On behalf of Puerto Rico's children and youth, I want to thank you for taking the time today to be with us. We know it's been a rainy day, it's been a really hectic day on the floor, so we really appreciate all you have done to get here and to learn more about the challenges that children and youth in Puerto Rico are facing. My name is Amanda Rivera, and I am the Executive Director of the Youth Development Institute of Puerto Rico. For those of you who do not know who we are the Kids Camp partner in the island, and as such, we are the only entity dedicated to advancing the needs of children and youth in the island through research and data that raises awareness about the challenges that they face, the development of public policy recommendations, and advocacy to make sure that these recommendations become a reality. Before we begin, I want to take a second to thank Congresswoman Jennifer Gonzalez and Congresswoman Nydia Velázquez for enthusiastically agreeing to co-host this event. Thank you so much for showing up for Puerto Rico's children in this way. And I also want to thank her staff, who has also been immensely helpful in this process of setting up the logistics and helping us navigate our first congressional briefing. So I want to recognize Matt Gomez, who's here from Representative Velázquez's office, and Janiel Rodriguez, who is also here from Congresswoman Gonzalez's office. I also want to recognize the presence of staff from the Annie E. Casey Foundation that is in the room. The Annie E. Casey Foundation really makes our work possible, and in addition to that, they have been an advocate for children in Puerto Rico for many years. So champions like Congresswoman Velázquez, like Congresswoman Gonzalez, and like Annie E. Casey Foundation have been invested in the well-being of Puerto Rico's children way before the hurricane happened. But it is important to recognize that the impact of Maria really brought on another layer of significance and urgency to our work. As you all know, last Thursday we had the 1-year mark of the hurricane. And for everyone that was in Puerto Rico during that time, everyone I spoke to last week, Thursday morning was a really hard morning. People said that they cried, that they felt a great deal of sadness as they remembered the events that had taken place on that day. On the day of Maria, we were all petrified with fear. In the aftermath, we were really shocked to see the level of destruction around us. And following the days following Maria really represented a great deal of anxiety, despair, and uncertainty for everyone that lived. So really, for most of us who lived through that hurricane or survived it, there's life before Maria and there's life after Maria. And it really marked us in ways that sometimes we just cannot explain. But if that had the effect on adults, imagine what it did for children. And so just to paint a picture, the homes of many kids were shred by the wind, they were flooded. Power did not return to communities for many months after that. And in the weeks after the hurricane, some children even went hungry. With lost employment and reduced hours, parents struggled to make ends meet, to pay bills, or even put food on the table, and that brought another layer of toxic stress into the home. And the thing is that children didn't really have anywhere to go during this time. The schools were closed, the parks were destroyed. And so really, if you think about it, it was like the rug was pulled underneath from them. Their whole sense of stability was completely destroyed. And so that is why we are here today. We are here to understand, first of all, how the hurricane impacted children and youth. We are also here to talk about what the conditions were like before the hurricane. And we also want to be proactive and talk about some potential solutions for addressing those challenges. Before we begin with our panel of experts, what I want to do is going to provide an overview of what the conditions were like for children in Puerto Rico before Maria, because it's essential for all of us to understand that we cannot go back to the day before Maria. Okay, the day before Maria, the majority of Puerto Rico's children were living in poverty, and each year we had less and less children as young families were not seeing Puerto Rico as a place of opportunity and were leaving. So being that we are an entity that is known for its ability to compile and disseminate data, I'm going to paint a picture using numbers. If you are a child in Puerto Rico, you are likely to be living in poverty, and there's a good chance that that poverty is extreme. The day before Maria, 57% of children in Puerto Rico lived in poverty, and 39% lived in extreme poverty. To give you context, that's almost twice as high as the poverty rate of New Mexico, which is the state with the highest level of child poverty in the US. New Mexico's child poverty rate is 30%. And a question that we get a lot is, isn't the cost of living in Puerto Rico less, and so it doesn't really matter? And the answer to that is no. The cost of living is about the same, and depending what jurisdiction you compare it to, it's even more. So those numbers really represent economic hardship and lack of opportunities for children and youth. Also, something that is important to take into account about the child poverty rate in Puerto Rico is that that rate has remained constant for the last 20 years. So in 1999, when by most economic indicators Puerto Rico's economy was doing well, the child poverty rate was still 58%. So what that tells us is that there's something more to this child poverty rate that does not have to do with economic activity. There's something else at hand. So something else for you to know is that if you are a child in Puerto Rico that is born in certain towns, such as those in the mountainous regions or in the southeast of the island, which, as some of you know, were the hardest hit by rain and wind, you are almost certainly living in poverty. Some towns in those areas have child poverty rates as high as 80%. An example of that is Maricao, which is a small town up in the mountains. If you're a child in Puerto Rico, it is also likely that you are living in a home headed by one parent. 61% of Puerto Rico's children in 2006 lived in single-headed homes, and the majority of those were headed by mothers. If you're a child in Puerto Rico, the odds are that you are not proficient in reading or math. The day before Maria, the reading proficiency rate for fourth grade students was 44%, and the 8th grade math proficiency rate was 10%. When you become a teenager, you will be more likely than your counterparts in the States to not be in school or working. The day before Maria, 13% of youth ages 16 to 19 were considered to be disconnected youth. And as you begin to grow and think of a family of your own, odds are that you will choose to leave Puerto Rico or have one, if any, children. Between 2007 and 2017, Puerto Rico lost 35% of its child population. That Puerto Rico has lost so many children, and that the majority of children in the island are living in poverty, and were living in these conditions even before a Category 5 hurricane hit the island, for us is an emergency unto its own. It is not only a human rights issue, but it is an issue of economic development and sustainability. If we have less children, and these children are living in poverty and have poor educational outcomes, our question is, who will be Puerto Rico's workforce in the future? Who's going to contribute to its tax base? Unless we implement comprehensive policies aimed at reducing child poverty and improving outcomes, Puerto Rico will not prosper. So since we are also here to talk about solutions, I finally want to talk to you about something that Congress can do right now, and that is the extension of the child tax credit for families of 1 and 2 children in the island. Right now in Puerto Rico, only families of 3 or more can claim this credit through their payroll taxes, which we do pay. And this recommendation was included in the Congressional Task Force for Economic Growth's report, and it was a bipartisan recommendation. And as a matter of fact, it has been included in 9 different bills, 4 Democrat and 4 Republican, but it has never come through. So while we know that this alone will not solve all the issues of children in Puerto Rico, it is one step in the right direction, as plenty of evidence, as we will discuss later in our panel, points that this is an effective policy for reducing child poverty. And it will provide a boost for working low-income families. It will help families get back on their feet. And in the end, we think it's a common sense policy that has bipartisan support, is good for kids, and promotes work and opportunity in an island where poverty and now a hurricane are pushing people to leave. Our ask today is simple: swift bipartisan action on this issue over the next weeks. And we hope that everyone here can take that message back and act on it quickly. So now that we have presented an overview of the condition of children and talked about one potential solution, we're going to go on to our panel of experts. So to give you an idea of what we will be presenting today, we're going to first start with Dr. Graham Castillo. He's president of Estudios Técnicos, and Estudios Técnicos is one of the partner organizations that conducted a study on the impact of the hurricane on children. It's important to know that that study was commissioned by us, by the Youth Development Institute, and it was funded by Save the Children, Massachusetts United Fund, and Fundación Ángel Ramos. The final study is going to be ready in December, and it's going to include a qualitative component and policy recommendations, so stay tuned for that. We will then hear from John Martinez, Director of Program Development at MDRC, who will provide an overview of the conditions of youth and their engagement in the workforce, as well as share some lessons learned in a study that is also underway in partnership with us, with the Institute. We will then hear from Jana May Demaray, Director of Save the Children's Domestic and Emergencies Unit, who will provide her perspective on the challenges faced by children in Puerto Rico and how it compares to other natural disasters that she has worked in. After this, we will begin discussing some policy solutions. So we will hear from Dr. Marien Chautegui, Acting Dean of Economics Department at the University of Puerto Rico, who will discuss the potential of tax credits for reducing child poverty. And finally, we will talk to Dr. Gustavo Bobonis, Chief Economist at the Center for the New Economy, who will discuss how the Tanf program can be optimized to reduce child poverty in Puerto Rico. So before we go to Graham, to Dr. Castillo, I want to just read his bio. Dr. Castillo is an economist and lawyer and president of Estudios Técnicos. He has over 25 years of experience in economic and social research in Puerto Rico. He supervised the preparation of a number of key projects over the years, including the Puerto Rico Housing Needs Assessment and the State Housing Plan, and conducted for the Department of Housing in Puerto Rico and the U.S. Department of Housing. In 2018, he coordinated a housing policy report for the Home Builders Association. He has also been responsible for studies that evaluate the economic and social impacts of national parks, mass transportation system, public-private partnership initiatives, and technological innovations. He has conducted cost-benefit analysis required by federal regulations associated with roads, flood mitigation, resilience projects, and other infrastructure investments. He was trained in Puerto Rico at the Inter-American University School of Law and the University of Puerto Rico, Rio Piedras. So with that, I leave you with Dr. Castillo.
Thank you for the honorary title.
Oh, yes.
Anyway, good afternoon, members of Congress, staffers, and all of you that have taken up your time to be here with us this afternoon. Our firm, in particular, the team that participated in the study, is honored to be here to present the findings of the study on the impact of Hurricane Maria on the children of Puerto Rico. I want to recognize Anita Cox, our Director of the Social Policy Division, for the outstanding work she did in implementing and executing this study. And unfortunately, she couldn't be here with us today, so I'm taking her place, and thank you. As practitioners of economic and social environmental and land use policy, it is our understanding that the results of this study and the body of knowledge that it provides, it's required to prioritize programs and policies that aid with the development opportunities of disadvantaged families with children. In the current post-disaster context, it is fundamental to understand how children and their families have been impacted as a result of Hurricane Maria, to develop actions, policies that contribute to the family's long-term recovery and resiliency. In that direction, this initial phase of the study for the Youth Development Institute seeks to answer to what extent has the economic health and educational situation of families with children in Puerto Rico was impacted by the hurricane. The study relied on a survey of a representative sample to 705 households, which was stratified at a regional level and by income level so that we can compare results on how the different populations were impacted differently by the hurricane. The general conclusion of the study is that the children living in poverty are more likely to suffer disproportionate effects on their well-being in disaster events. And this is a lesson to be learned not only in Puerto Rico but across the nation. Their likelihood to be destabilized and negatively affected by the hurricane was documented. They were more likely, I will make some statements that basically provide you the foundations of that general conclusion. They were more likely to have experienced flooding in their homes. 40% of the families with incomes below 15,000 annual income experienced flooding, in contrast to 28% among families with children earning more than $40,000 annually. They were more likely to have a reduced access to food, as 24.7% of families with an income of $15,000 or less suffered this situation, in contrast to 4.7% among families with incomes above $40,000. This is five times more prevalence to experience this situation. These children were more likely to suffer separation from their families, as 7.3% of children living in poverty were separated from a family member after the hurricane, in contrast to 2.3% in household earnings with earnings above $40,000. And they were more likely to have experienced the loss of personal belongings and clothing. As much as 47% of families with children with annual incomes below $50,000 reported this situation. Half as much with middle incomes, or incomes between $15,000 to $40,000, and 14% among families earning more than $40,000. This is concerning when it is considered that the majority of children live in homes with very little economic security and an ability to replace those personal belongings. In fact, a sociological study by Forder, Hill, and Peak found that those children suffering scarcity of basic needs that lost everything as a result of Hurricane Katrina were less likely to complete high school or to attain employment as young adults. Not only were children living in poverty more likely to be adversely affected by the hurricane, but their economic insecurity was further aggravated by the hurricane. As much as 31% of families with children suffered loss of income. 20.4% had their hours of work reduced. This was relatively the same across all economic classes, which basically shows us how this hurricane affected our production capacity, mainly because of the loss of power and the damage to assets, to productive assets. However, 22.5% of families with children with incomes below $15,000 lost their jobs, in contrast to 16.3% for families with incomes above $40,000. Transportation was also an issue. This affected basically access to health, access to food, access to education. This is, as we all know, it's a limitation, it's a barrier to get to work and to find gainful employment. This situation of loss of transportation was 6 times higher among people earning $15,000 or less. As much as 13.2% of those households lost their vehicles, in contrast to just 2.3% of those earning $40,000 a year. It is not surprising then that 32.3% of families with children and income of less than $50,000 said that their economic situation is worse after the hurricane. This was much lower for families earning $40,000. A little more than 1/4, or 22.2% of families with children surveyed said that they had less income today than before the hurricane. The study identified how economic instability manifested in the days after the hurricane. Respondents to the survey said the following. They had an inability to pay basic utilities. On average, it was 3 in 10. 40% in families with incomes below $15,000. They also had an issue purchasing food. That was 3 in 10 families in Puerto Rico, and as much as 4 in 10 families in families with incomes, families with children with income below $15,000. They also had issues paying their telephone bills. Of course, we didn't have communication in Puerto Rico for a while, and also things like basic things like buying clothing and personal items to 19%, as much as 23% in lower income families. And also buying school supplies, which is an issue when it comes to access to education and educational materials. More concerning in the middle and long term is the impact of hurricane on migration trends. As you may know, in Puerto Rico, we have been going through a major reduction in population that is affecting everything in the island. As much as 30% of families with children surveyed said that they were likely to move as a result of the disaster, of which half said they would migrate to the United States. This means that we, based on these results and other results, we have had to review our migration estimates looking forward. So we are expecting higher, more accelerated reductions in population looking forward above what we had experienced during the past couple of years. So moreover, children's education and routine was severely disrupted. This was especially true for children with disabilities and special education needs. Children between ages of 0 to 4 years of age lost an average of 92 days of child care or school, while those with ages from 5 to 17 lost an average of 70 days of school. Also, 23% of children between ages 5 to 17 displayed a change in behavior in their school environment. The leading behavioral change has been the lack of concentration. Meanwhile, 84.6% of students with disabilities experienced interruptions in their services, and at the time of the survey, 10.3% of the children were still not receiving educational services. The hurricane also altered the behavior and engagement of children in early school education, where 72% of children under 5 have demonstrated disengagement for fear, lack of interest, and concentration problems. Parents and caretakers also noticed changes in behavior. 44% of families surveyed said that their children experienced some change in behavior as a result of the hurricane. The leading behavioral changes have been anxiety with 23.3%, fear with 18.7%, sadness with 16%, and disturbing memories of the hurricane, 15.2%. And I can tell you that when this previous hurricane was announced, my sister, my kids were kind of terrified with the whole situation. So it has a prevailing impact on our children. Finally, nearly half of the families, 48%, have a plan in place in the event of another hurricane. Of course, we must strive for higher percentages of preparation, but this is a challenge. It's a social, it's an educational, it's an economic challenge to reach those levels of planning in our society. I hope this information has been able to provide you with additional facts on how disasters manifest disproportionately on families with children living in poverty conditions. Thank you, and I'll be available for questions.
Thank you. I also want to point out that if you picked up some of the materials that we had out there, you'll find a summary of the findings, a 4-pager. So please make sure that you take that with you. We are now going to have John Martinez present. John is the Director of Program Development at MDRC, where he oversees grant management and funder relations and plays a key role in new program development across MDRC's 5 policy area. Prior to his current role, he served as a Deputy Director of MDRC's Health and Barriers to Employment policy area, where he focused predominantly on projects targeting young people, including young people with disabilities and those in the foster care and juvenile justice systems. Martinez currently serves as the chair of a board of directors of the National Youth Employment Coalition and is a member of the Association for Public Policy Analysis and Management's Policy Council. Before joining MDRC, Martinez conducted research in a substance abuse treatment center and in a community health center with patients with schizophrenia. He began his career as a food stamp eligibility worker. Martinez holds a Master of Public Health degree from Columbia University.
Great. Thanks, Amanda. So this table is really high and my chair is low, so I feel like I'm a kid sitting at the adult table at Thanksgiving. And I'm used to moving my arms when I talk, so I apologize if I hit either one of you. So as Amanda mentioned, my name is John Martinez, and I work for MDRC. MDRC is a nonprofit, nonpartisan education and social policy research organization. We have a 40-plus year history of building evidence to inform policy and practice. And with support from the WT Grant Foundation, we're privileged to be partnering with the Youth Development Institute and our colleague, Dr. Hector Cordero Guzman, to better understand and utilize the evidence base around youth employment and contextualize it for Puerto Rico to support a broader policy agenda. In my short time today, I would like to cover 4 broad topics. One is just providing a little bit of an overview of youth employment in Puerto Rico prior to the hurricane, and then touch a little bit on what effects disasters like Hurricane Maria can have on youth more broadly. I want to talk a little bit about some of the learnings that are coming from our work in Puerto Rico, and then some initial suggestions around how to support youth employment in Puerto Rico. So in these comments, I'll be drawing heavily from analysis our colleague, Dr. Cordero Guzman, has been doing using various data sources, including the Puerto Rico Community Survey. And here it's primarily focused on 2016 data, which at the time we conducted the analysis was the most current available, though I believe the 2017 data was just released. We haven't had time to dig into it yet. And as Amanda mentioned, the poverty rate for youth in Puerto Rico, and no matter how you slice it, but here talking about youth age 15 to 25, is high. And it really hasn't decreased significantly since 2000. So thinking about the employment context, it's important to think about that as well. So with regards to employment, in 2016, about 30% of youth age 18 to 25 were employed, but that statistic masks significant variation across age ranges. For example, for those young people who are 18 to 19, so in the younger age of the continuum, the employment rate was closer to 9%, while it was close to 50% for those who were in the older age range. And while this does represent some improvement between 2000 and 2016, it was really an incremental improvement, just a few percentage points. Those categorized as unemployed, on the other hand, were much more consistent across these age ranges, and in 2016, it was about 17%, which is almost double the US average for unemployment. Now, it's important to keep in mind these statistics predate Hurricane Maria, but taken together, I think they present a sobering picture of the state of youth employment prior to the hurricane, and these will likely be exacerbated by the current conditions in Puerto Rico. And certainly other recent natural disasters suggest this will likely be the case. For example, the Bureau of Labor Statistics, the BLS, did some analysis post-Hurricane Katrina, and just to remind folks, Hurricane Katrina was in August of 2005. And though that analysis was not specifically concentrated on youth, it presents a challenging picture of the post-disaster employment landscape. They reported that in 2006, the year-over-year employment losses were over 9% for all of Louisiana and much higher in the affected areas. And more recent estimates suggest that the employment dropped by over 40% in New Orleans Parish, which is where New Orleans is. Now, turning to our work, though our work is focused on how to tackle youth employment as a way to counter the significant poverty in Puerto Rico, there are, of course, other repercussions to the storm. As Amanda mentioned, and as we just heard, during our interviews, the interviews that we've been conducting with key informants in Puerto Rico as part of this work, many of them discuss the stress and trauma that young people in Puerto Rico face in the aftermath of Maria. We heard stories of hopelessness and depression, and while anecdotal, the research supports these findings. Numerous psychological and epidemiologic studies post-Hurricane Katrina found higher prevalence of post-traumatic stress disorder, serious emotional disturbance, and other mental health issues. But to be honest, as a researcher, I can say that even without this corroborating evidence yet, it is clear that young people in Puerto Rico have suffered tremendous stress and loss that will need to be addressed for the sake of their mental health. Moreover, even if there are employment opportunities, the psychological toll will likely affect youth entry and success in the labor market. So aside from these very real issues related to stress and trauma, what else have we learned in the course of our work in Puerto Rico? First, and perhaps not surprisingly, and you've heard this earlier today, out-migration is a significant issue. Pre-Maria, the differences in labor force participation and earnings between Puerto Ricans on the mainland versus Puerto Ricans on the island was significant, which contributed to the lure of out-migration, and Maria is adding additional pressure to that. Anecdotally, one of the youth providers that we interviewed in Puerto Rico mentioned explicitly that he encourages young people who complete the program to move to the mainland because there are no opportunities in Puerto Rico. Additional analysis will need to be conducted to understand the extent and impact of out-migration, but the results will likely be a continued aging of the population overall, as Amanda mentioned, and brain drain. Another important issue that emerged in our discussions are the barriers to employment that young people face. Now, while these aren't necessarily unique to Puerto Rico, the context places added urgency to addressing these barriers. Informants mentioned the lack of soft skills among young people, misalignment between the K-12 system and labor market, lack of prior work experience, and the challenge in providing the level of support that many young people in Puerto Rico need in order to navigate the labor market successfully due to provider staffing and budget constraints as significant barriers. Our forthcoming document that summarizes these and other themes will have much more detail on what we learned from these key informants. In addition, it will summarize the state of evidence related to youth employment, primarily based on our evaluations in the U.S. mainland, but will include some discussion of the implications of that evidence base for the context in Puerto Rico. So based on our work thus far, what would our team recommend in order to address the issues young people in Puerto Rico are facing? First, we believe it will be important to better understand and address the impact of Hurricane Maria on the mental health of young people in Puerto Rico. Second, we believe that Puerto Rico should take advantage of some of the programs that other states in the mainland have taken advantage of. For example, Puerto Rico already has a Job Corps site and a National Guard Youth Challenge site, perhaps exploring bringing Youth Build to Puerto Rico. Given its roots in construction, it could provide opportunities for young people to be engaged in infrastructure and repair efforts. Another example is the Jobs Plus program, which brings locally based jobs-driven approaches to public housing residents. This would also help to bring evidence-based programs to the island, ensuring that government resources are supporting what works. Finally, based on our interviews and our understanding of the workforce system, efforts to improve coordination and communication among agencies and departments that offer workforce services and to address inconsistencies strikes us as important. Thanks for the opportunity to be here today. As I noted, we are planning to release a more comprehensive document summarizing our work on this in the coming weeks, and we are hoping that this will help inform the efforts to support young people's connection to the labor market in Puerto Rico. Thanks.
Thank you, John. Now we're going to hear from Jana May Desmarais. Is that correct? Am I pronouncing your last name correctly? Yes, okay. Jana May Desmarais is currently the Senior Advisor for U.S. Emergencies at Save the Children. She was the Director of Save the Children's Domestic Emergencies Unit. She was instrumental in establishing that unit in 2006, helping to develop the strategic plan, build response capacity, and lead preparedness, response, and recovery program planning and implementation. Desmarais serves as team leader on Save the Children's disaster response teams and manages the U.S. REDI team's 43 members. She was team leader for Save the Children's Hurricane Katrina response programs in Mississippi, Louisiana, and Alabama. Prior to joining Save the Children, Desmarais worked for the Maryland's legislature, chairman of the Joint Committee on Children, Youth, and Families, serving in both his legislative and political offices. In that role, she helped create and implement a large multidimensional legislative agenda strategically designed to improve disadvantaged children's and families' well-being. The agenda included a results-based school readiness initiative and was focused on ensuring that programs funded by the legislative and executive branches serving children and families were results-based, collaborative, and effective. Before working in the public sector, Desmarais taught middle school in Colorado and in the inner city. Desmarais started her career working in international healthcare for the Pathfinder Fund, and she holds degrees from Tufts University and Johns Hopkins University School of Public Health. Thank you for being here.
Thank you very much. And I want to say a sincere thank you to the champions who are in this room, really the members of Homeland Security. I know Congressman Thompson's office, Congressman Payne's office, and so many others. FEMA is here. You all personally have been the champions for children throughout this crisis. And please carry our sincere thanks, and I know so many people's sincere thanks back to your offices and back to your bosses. So truly. I had the privilege of, I've been asked to talk about what's different this time. I've been on the front lines of so many disasters across the U.S. and really what has made it more difficult for children in Puerto Rico, because there is no question it is the most difficult recovery that this country has faced in recent history, known history, really, when you think about it. And I had the privilege of testifying a couple months ago for Homeland Security, and there were other people on the panel who were saying, well, the lights are back on and progress is being made, and it was a very optimistic view of progress. And it really struck me, once again, children are invisible in this crisis. The services and supports that children count on so often do not rise up. You hear about the grid, you know, that the infrastructure in Puerto Rico was old, that the grid didn't come back on. What you don't hear about, and it's a factor related to the poverty that is there, but that the infrastructure of the services and supports that children and families count on to learn and to thrive, we're also not strong and resilient. And we're devastated by the impacts of the storm. And so you don't hear that side of the story and that side of the recovery, which again makes it really, really difficult. So Save the Children as a global agency, we work in 120 countries around the world. And we are unique in that we also work within the U.S. to support the most at-risk children when they're affected by a disaster and when they're affected by endemic poverty. And when the 3 hurricanes happened last year, we ended up deploying some of our international experts who do humanitarian work because the conditions were so severe. It was much more like a response in places like Rohingya in Bangladesh, where there were no services and supports, and where the basic delivery of services and supports were so compromised that there was so little happening in the early days because of the damage to roads and airports and infrastructure. But again, kids were at such grave risk. We really deployed in a team that combined both our domestic experts but also our international experts to try to meet children's needs. We are committed to the long-term recovery. We've served more than 100,000 children who are there to date, but that's a drop in the bucket compared to what the need for children the needs for children are. So again, what's different? Mental health, the gaps, the profound fear that relates directly to the storm that battered the island for so many hours, and then it was dark for so many days and weeks. The level of fear and trauma for children and their adult caregivers is tangible every day for teachers, for parents, for children. So the need for mental health recovery support is profound, but the ability, the current capabilities on island to deliver those recovery supports and services and programs are lacking. That's true across every disaster we see. That's true right now in North Carolina. That's true everywhere in the U.S., but in Puerto Rico, it's even more profound. Second thing, schools and childcare and early learning. We've heard repeatedly that kids in Puerto Rico were behind their peers in the States when the storm happened, both in literacy learning and numeracy learning. But what I think has not been made clear enough is so many children, I know that you referenced this, you both did, that kids lost 30 days, 60 days, 90 days. For many children, it was even much more than that. And these are the children in the U.S. who can least afford to lag behind even further. So for many of these children, the tragedy is that they will never catch up and never be able to really fulfill their own abilities because of those gaps. The other thing is gaps in feeding. Thank you. So many children, and this is something we're seeing more and more on the front line of every response in the U.S., more and more children are dependent upon school and early learning feeding programs for 3 or even sometimes 4 meals a day. That's their only source of feeding. And so when schools are as devastated as they were in Puerto Rico and as unable to reopen, it profoundly affects children's nutrition, which has a direct impact on their health, well-being, and ability to thrive. So again, was it worse than other places in the U.S.? Absolutely, no question. The last thing, so the 4 areas, again, mental health, schools and early learning, feeding support, but then also lack of resilience. And this is resilience of the programs children count on and families count on, resilience in the home, for a home to be able to rebound after a shock like the hurricane, and also resilience of children themselves. So what can we do about it? Save the Children is continuing to put forward a few critical recommendations. Globally, we are advocating that no child during a disaster or after a disaster or crisis should be out of school more than 30 days. And my goodness, that should certainly be true in the U.S., that we are able to get children back into regular learning programs, again, early learning or school-age learning programs within 30 days. Our second thing is that we should, at the national level, conduct and fund a study about short-term and long-term impact of disasters like Katrina, but the hurricanes this year also, their impact on students and schools. And what does that look like? The recovery after disasters, what does that look like for schools and childcare? I know many people in this room have actually been partnering with us to amend Stafford to include childcare and early learning, at least nonprofit as a starting point, on the list of critical services that receive immediate recovery support or that qualify for recovery supports through Stafford. I believe we're making good progress on that front, thanks to many of the advocates in this room. So I think that actually that's it. In terms of the primary, the other one is fund mental health recovery services. No question about that. That is the most profound gap on every disaster, but in Puerto Rico, it is even more dire and urgent. So fund that. And what that means is also you have to fund education programs to train teachers, train mental health care providers in specific programs that support child recovery after a disaster like Hurricane Maria. So again, thank you for including us in this important panel.
Thank you. I think it's really interesting how Jenna May mentioned that one of the goals is to have children out of school for 30 days or less. And in Puerto Rico, we heard that and on average, kids were out of school for 78 days. So just to give you a contrast of how far off we were from an ideal response situation. So now we're going to move on to Dr. Maria Enchautegui. Dr. Maria Enchautegui is an economist and interim chair of the Department of Economics at the University of Puerto Rico, Rio Piedras campus. Dr. Enchautegui brings experience from the academia, federal government, and policy think tanks through her work. Dr. Enchautegui has published over 50 research articles in academic journals in both local and international public policy contexts. She has also served as a consultant for a variety of public offices like the Office of the Comptroller of Puerto Rico, the Department of Labor, Women's Advocate, among others. She worked for 10 years as a senior researcher at the Urban Institute in Washington, D.C., one of the leading think tanks of public policy in the United States, where she conducted multiple research studies. Her areas of specialization are labor markets, working conditions, migration, economic security of families, and family demography. Dr. Enchautegui holds a doctoral degree in economics from Florida State University and a postdoctoral degree from the University of Michigan. From 2010 to 2012, she was appointed by President Barack Obama as a senior advisor for the U.S. Department of Labor in Washington, D.C. Thank you for being here.
Thanks for inviting me. I think I have to start by repeating what I have said already a couple of times here, that as of 2016, 57% of Puerto Rican children were poor. Yet, Puerto Rico is said to have achieved great development. Yet, poverty rates like this high undoubtedly hinder opportunities and freedom, and at the end, it hinders development. I take the view of stated by people as diverse as Lyndon B. Johnson and Amrita Sen to fight poverty because it's a struggle to give people a chance, to allow them to develop and use their capacities. Fighting children poverty is about what these children are able to do and what these children are able to be, and the environment that enables them the opportunity to develop their capabilities. That is, I think, what is talking when we're talking about children's poverty. Puerto Rico child poverty is quite stubborn. Just focusing on the period since 1990, there was great progress in the 90s, but progress started after that, as Amanda mentioned. During the 90s and up to early in the 2000s, adult poverty rate declined by much more than the children poverty rates. Since the onset of the crisis in 2007, the poverty rates of children have changed little, and the adults' poverty rate declined somewhat. Why poverty rates have not increased by more during the crisis is something that deserves more attention. Maybe it is that there is a core of poverty that is not closely related to the economic conditions. Or it could be that we are exporting the poor. We have to experiment to see why is that. But we don't have information on whether these children live on persistent poverty or whether they come in and out of poverty. But with the help of other indicators, one might gather that the situation of poverty of Puerto Rican children is, we're talking about persistent poverty. For one, a good share of poor children, as Amanda said, 37%, live in extreme poverty. They are at the bottom 50% of the poverty level. Most of the children live in areas of high poverty concentration, 84% according to Kids Count. And I also see, and this it's not easy to see it in very basic data, but I also see a lot of disconnectedness from the labor market among the parents of poor children. It's not only joblessness, but prolonged joblessness. A good share of children in poverty live in households where nobody works, and moreover, where parents seem to be disconnected from the workforce for a prolonged period of time. Among heterosexual households and spouses in working age that were not working, about 3 out of 4 of them hasn't worked in the last 5 years. This prolonged joblessness, I think, have implications for how we address child poverty. I think we have to make a taxonomy of children poverty according to their household. For instance, poor children that live in families with working families and low wages, poor children that live in families of able-bodied parents but no work, poor children that live in families of elderly parents or even disabled parents, and see what are the policies that fit each one of those categories. But in spite of the high poverty rate of children, there hasn't been a targeted effort to deal with the problem of poverty of Puerto Rican children. A survey, actually, Estudios Técnicos here made that survey in 2015 of over 400 community-based organizations, and 63% of them say that they serve the youth. But then when you look more closely what kind of services they are providing, you see a lack of very specific service to address youth problems. For instance, only 52 of those 400 were addressing issues of drug addiction, and only 55 were addressing issues of high school dropouts. I also went through the last 5 programmatic commitments of the Life Forward governors of Puerto Rico. None of them addressed the issue of children poverty. Only one addressed poverty, but more within a family context of family well-being. But none of them are talking about children poverty. Most of them talk about children related to abuse and neglect in a transactional manner of how the government handles these cases. But the issue of child poverty as a core issue moving forward is not in any of these 5 programmatic commitments of the last 20 years. In the 375-page recovery plan that the government of Puerto Rico put out, the term child poverty or children poverty doesn't appear at all. What happened to schools after the Hurricane Maria is an example of how children are not in the radar of policymakers. As we says here, 78 days out of school. Some of these schools were being used as shelters. So somebody didn't think about that, right? They're thinking in a system way, because you would have thought that they would have think about that, no? But, and not surprisingly, our data, we are doing a study with me and other colleagues at UPR, show that 29,000 children transferred out of public school and went to the United States during that year. Maybe if a school would have opened earlier, we haven't lost that many children. Schools are instrumental in providing stability to children after natural disasters. But in spite of the outcry of communities to open their schools, the schools remaining closed. The number of calls to the hotline for reporting child abuse increased to over 1,000 in October 2017 after a downtrend before that, and have remained a little bit high. But there was no system in place to attend them. Many offices were closed. The computer system of the people that see of the cases of child abuse were not in place. So nobody was thinking about this system during the hurricane. But in addition to the lack of leadership to address the problem of child poverty and how key systems did not work for children, we also have another issue that I think is important, and is the federalization of Puerto Rican child poverty, which has put too many constraints on how Puerto Rico can respond. A large share of funds to impact child poverty come from the federal government, SNAP, WIC, Child Care, Tanf. And according to the Institute of Youth Development, out of 10 programmatic areas identified as important for children, 4 are intensive in federal funding, and a 5th is moderate on federal funding. So 5 out of 10. But you will say, well, that's good, because the other 10 are more local. No, because those 5 out of 10 account for $8 billion. The other 5 account for only $1 billion. According to Julia Isaacs, a co-author from the Urban Institute, in her report about expenditure on children, state and local governments cover 65% of the federal expenditure on children. I couldn't find a comparable figure for Puerto Rico, but just looking at education, the average state gets 7% federal monies for education. Puerto Rico gets 39%. The high share of federal funding of Puerto Rico could be a good thing, especially in a period of crisis where there is not much money to go around. However, it puts sometimes too many constraints, because a lot of these programs are not crafted to the needs of Puerto Ricans. For instance, this same study by Julia Isaacs shows that the federal government is increasing funding for child health, which is a good thing, even in Puerto Rico. But even before Affordable Care Act, Puerto Rico have a very high coverage of health insurance, even for children. The federal government is investing in youth and in youth employment and recreation programs. In a country like Puerto Rico, where 27% of the youth are unemployed, and where crime rates are so high, we are divesting in areas that can be critical because the federal government is not putting money there, and we just depend too much in the federal government for funding. Certain programs that are very good too, also crafted within the Congress. For instance, Vivienda en Acción, Son Press, was a program that was for years addressing issues of poverty, but only in Puerto Rico. Those programs were in place only in public housing projects. The landscape of poverty in Puerto Rico is very different from the landscape of poverty in the United States. And restricting a lot of those programs to only public housing children, you exclude a lot of poor children. And due to that peculiar institution of the Estado Libre Asociado de Puerto Rico, our children are precluded of precious federal government programs. According to Julia Isaacs, again, and co-author, the most expenditure of federal dollars come from in the way of tax provisions such as tax-dependent exemptions, EITC, child tax credit, but Puerto Rico gets none of that. So what can be done? We have been advocating for a while for the earned income tax credit in Puerto Rico. The earned income tax credit was in place for a couple of years, and now it is pending to see if it's going to be included again in the tax reform. We think that a tax credit tailored to our working families with children is one of those policies that could alleviate hardships and makes work pay for help in the poverty of Puerto Rican children. We also agree with Amanda regarding the child tax credit and expanding to families with 1 and 2 children. Government assistance programs needs to be adjusted more to complement the income of working families. Income stabilization is very important for Puerto Rican families, and I think we are seeing it in the post-Maria times. I mean, there were data here where a lot of the families that lost their income. The initial claims for unemployment insurance in October was 8,000, 8 and more than the month before Maria. 8,000 people claiming unemployment insurance, 54,000 claiming newly unemployment insurance, 54,000 in total, 22,000 more than the month before Maria. About 5,000 businesses closed and been open. That is people, families out of the workforce. The establishment employment declined by 40,000 between September and October, November of 2017. So Maria was a very big shock, economic shock to families, that sometimes we don't talk much about it. And these policies I just mentioned to you help stabilize the income, also during the period of disaster. But we need to know more. We have to start putting in place interventions and track how they work. We in Puerto Rico, we have to look not only at what the states are doing, but also what other countries are doing. In Mexico, for instance, poor parents are paid for keeping children in school and meeting other health and nutrition standards called Prospera. Conditional cash transfers are also being used in Brazil and Colombia. In some poor countries, women and youth are getting loans to build their businesses. In Boston, a group is using brain science to tackle child poverty. In Connecticut, Child First is giving a vast array of services to poor families in their homes. They go to their homes. Some people even have called to just eliminate all the elimination of tax-dependent exemptions and the child credits and just give cash to families with children. So a lot of people are thinking out of the box. I think we have to think out of the box and tackle this problem that has been going on for so long.
Thanks so much. Right now, Dr. Anchaltegui talked a little bit about how federal programs affect child poverty, or programs that are directed at reducing child poverty. So Dr. Gustavo Bobonis is now going to kind of zoom into that and talk a little bit about how Tanf works in Puerto Rico and some opportunities and challenges with that program. To give you an overview, Gustavo Bobonis is professor in the Department of Economics at the Munk School of Global Affairs and Public Policy at the University of Toronto, where he holds the Canada Research Chair in the political economy of development. He's also chief economist at the Center for New Economy, Puerto Rico's first independent economic policy think tank. His research focuses on the socio-economic and political determinants of human development in low and middle income countries. This research agenda lies at the intersection of the fields of development economics, labor and household economics, and political economy.
He has published in distinguished academic journals, including the American Economic Review and the Journal of Political Economy. He has also served as a consultant for a variety of multilateral institutions, such as the World Bank, Inter-American Development Bank, and the Development Bank of Latin America, among others. He has held visiting appointments at Princeton University and the University of California, Berkeley. Professor Bobonis received his BA in economics from the University of Puerto Rico and his PhD in economics from the University of California, Berkeley. Welcome.
Thank you very much. Oh. I'm going to use yours. Thank you very much, Amanda, for the introduction, and thanks for the invitation to participate. So something that I'm going to do is actually echo a lot of the comments that have been raised by the previous speakers in terms of the work that we've been doing in Puerto Rico for the past number of years. So my colleagues and I, Deepak Lamba-Nieves from the Center for a New Economy, research director there, and collaborators at the University of California, Berkeley, have been interested for a number of years in understanding the economic and financial stability of low-income populations in Puerto Rico, including low-income families with children, and to better understand and be proactive about dealing with effective ways of dealing with the issue of promoting self-sufficiency of families with low incomes, and to improve the more broadly and holistic development of these low-income families. So in order to do that, we actually established a collaboration with ADSEF, the Administration for Socioeconomic Development of the Family, actually back in 2015, 3 years ago, to do two things. First thing was to better understand what are the actual constraints on the ground that basically sometimes hold families back from being able to achieve self-sufficiency and to improve their human development outcomes. And second of all, to also identify opportunities of how things could actually be improved at the local level in Puerto Rico to be able to make this happen. In order to do that, what we did is actually we started, I changed my hats and stopped becoming a researcher and became kind of like a pro bono consultant. So we basically did some research to identify, by just doing mixed methods work, understand what are the constraints that poor households face, and basically that replicates what we've been hearing all of the afternoon, and also to understand not just what happens to families, but actually what are the issues faced by government workers that actually are the people that are in the front lines of providing these services. And we did this in particular to dealing with the population of Tanf participants for a number of reasons. One is that that is actually the most poor of the low-income populations in Puerto Rico, and second of all, we were very intent on trying to make a big shift in terms of how does ADSEF is able to deal with program participants in TANF. And it's a program that ADSEF in Puerto Rico has had a number of issues over the years in order to be able to comply with federal requirements in terms of achieving the self-sufficiency of these populations, ineffectively, by the way. So I'm just going to repeat a number of the points that have been highlighted. But for example, from our field work, we identify that mental health issues seem to be actually chronic, not just post Maria, but actually pre Maria, have been an important obstacle for low-income individuals to actually achieve, maintain jobs, etc. Also, the mismatch between the skills that are provided by the public and the private education system at the K-12 level, and the skills that are demanded by the local labor markets in Puerto Rico, and actually a lot of the heterogeneity that even takes place across different regions of the island, believe it or not. It's a small place, but with a lot of heterogeneity in the needs in terms of employment demands across different parts of the territory. And let me see if I in order to not forget. So those are the standard demands on kind of what participants demand. Something else that we wanted to do was to actually open the black box of what limits ADSEF and the government of Puerto Rico to be able to provide the necessary services to these low-income families. And something that we realized by doing this work, and I'm going to give you an example very soon of what that was like is that, it's the government and ADSEF and other agencies have, to a large extent, even limited capacity to be able to implement and supervise and implement effectively the programs that are conducive to achieve these positive outcomes for families. And part of that is, there's limited capabilities, technical and others, to be able to actually supervise and monitor and do the actual work that's required to be able to ensure that families achieve better outcomes. So I'll give you a number of examples of that. One is, as part of the Tanf program in Puerto Rico and elsewhere in other states, families and participants are supposed to be able to receive appropriate occupational counseling and all sorts of hosts of other services to be able to, basically close those gaps in terms of soft and socio-emotional skills, be able to prepare families to be able to, get and maintain jobs. And actually, the government of Puerto Rico has been somewhat ineffective in being able to actually deliver these services over the past years. A stark example of that is that when we were doing our field work back in the late 2016, early 2017, before Hurricane Maria hit, by the end of the calendar year, only 2 occupational counselors were serving all of the Tanf population in all of Puerto Rico, and one of those actually quit by the end of the calendar year. So basically, Tanf participants had access to 1 occupational counselor during at the beginning of year 2017, and this is before the Maria disaster, right? Another example is that basically we understand that there's caseworkers and others actually require quite a bit of monitoring and follow through with participants. These are difficult difficult populations that require a lot of hand-holding, attention, and coaching. And caseworkers don't have the ability and the capacity to deal with the large caseloads that they actually have. So basically we identified a number of these potential problems. Lastly, another issue that has been raised, actually was raised by Maria just now, is the fact that basically the local programs in Puerto Rico that tend to suffer from the fact that there's a strong benefit cliff. Many of these low-income families, once they actually are able to achieve some degree of employment and self-sufficiency, will actually should I keep going? Yeah, of course, go ahead.
Hello. We have Congresswoman Gonzalez with us today, and we want to introduce her and give her a few minutes to speak. She has been a great champion for children's issues in Puerto Rico, and we're really thankful that she has co-sponsored this event and made time in her schedule to be with us. So I'll give you the floor for a few minutes.
Sorry about interrupting like this. You know how things are going, and this week is going to be a little bit challenge when you have the CR Omnibus and FAA among other bills that maybe will be brought to the floor during this week. So first of all, I want to thank the Institute of Rowing for Youth Development, in Spanish is easier, Instituto de Desarrollo de la Juventud, and the people from the Boys and Girls Club for always supporting the better being of our children. I want to thank the people in the panel for having the time, being here, and advocating for kids and families back home. I think there are many issues that were in the surface after the Hurricane Irma and Hurricane Maria, and I want to thank Dr. Maria Chautegui, Graham Castillo, John Martinez, Dr. Bobonis, Jan, Aimee de Moraes, and all the people from the Boys and Girls Club for making this happen. I really appreciate that. I think last Thursday we commemorated 1 year of Hurricane Maria, and that was not an easy day to witness. But also, I think that hurricane put in place and perspective what was going on with families and children on the island before the hurricane. And so the hurricane not only impacted the infrastructure of the island, but also impacted the families and aggravated our economic crisis and added a lot of mental distress to the island. I think these are post-traumatic distress disorder in the island after the hurricane. And we can see that actually hitting the stagnation of the children and young adults and population. And if we took the numbers from the census, there are more people from 60 years old than in the rest of the gaps. So that triggers another problems along the way. So that's the only generational group that has grown since 2010. So it's been 8 years that you got the people from 60 and over being leading that generation gap in the island, while young and middle-aged adults continue to decline. Most of them leaving Puerto Rico to the mainland, to Florida, Texas, and the eastern coast. And why is that? Because here they can achieve the child tax credit, here they can achieve earned income tax credit, and other provisions that will help them to surpass a lot of the difficulties they have in the island. Those results lead us to conclude that the generation impoverishment that we have in the island has been also mentioned by the Census Bureau. And actually, the census had identified that the highest percentage of children living below the poverty level within the lowest household income in Puerto Rico is going to be $20,000, compared to $41,000 in the state of Mississippi, which actually the highest poverty rate among the 50 states in the nation. So you can compare having $20,000 as an average income per household in Puerto Rico, now the last numbers, and having 41,000 in Mississippi. So they make the double, and they're the highest in the nation, but we are the highest as the rest of the territories. And if you compare that in the year 2016, it will be $57,000 nationwide. So we are not even below the average. It's more deeper down. So the poverty issue in the island, it's not just measured by the assets, it's not just measured by the income. We also need to explore how the experience of living in poverty may change the way of life of those kids and those families. And one of the issues is how the health is affected, how the education of those kids are affected, and their capabilities of social belonging and self-esteem are impacted directly because of those poverty issues. In that regard, several studies conclude that when children grow in poverty, there's a risk that most of them will not attend school. And that's the case in Puerto Rico. Experimented with food insecurity, they can develop poor motor skills in long-term health situations and experience chronic health problems, such as asthma and anemia. Both of them in higher numbers in Puerto Rico. So you have all those numbers, all those results, all those studies identifying a big problem about the poverty issue in the island. So what we did when we arrived here, I was elected in 2016. I'm the only member for 4 years in Congress, and but I can vote on the floor. So the way for us to push things, it's a little bit difficult than the rest of the members. So we filed HR 798, which is the child tax credit equity for Puerto Rico, that propose an extension of the child tax credit with families with 1 or 2 children, and I think it's important to have that. You will have it in Puerto Rico if you've got 3 kids, but not if you want 1 or 2. So that's one of the weirdest thing that Congress does, that if you got more children, you get it, but if you get less, if you get 1 or 2, you will not have it. There's no reason behind it. I mean, I've been asking on all committees, and no one knows why 3 yes with 1 or 2 no. I asked if it was the reason for having more children in Puerto Rico. It looks like that, but it's not. So this legislation will provide equal treatment for residents of Puerto Rico with respect of the refundable portion of the child tax credit. And for 1 or 2 children, that is currently provided with families with 3 children or more. For a resident of Puerto Rico to qualify to this limited benefit, he must be, pay the Social Security and or the Medicare, and have at least 3 dependents under the age of 17. That's the current standard on the island. It has estimated that this proposal will inject $2.9 billion on the island and in the Puerto Rico's economy over the next decade. So it's going to be 1,000 children with an average annual household payment of $770. So this is direct impact having this kind of measure. And I will tell you that in the Senate side, Senator Marco Rubio and Senator Orrin Hatch are supporting this kind of legislation. And actually, I was not the one who came with the idea. It is part of the PROMESA task force report that was submitted on December 2016. House and Senate, in a bipartisan way, recommended to Puerto Rico to have an oversight board for the fiscal situation of the island. But they also, Congress also approved a report in that December providing a guideline of the areas that should be amended in order to give Puerto Rico an opportunity of development. That was one of the ideas, the child tax credit. Another of the ideas that were there, it's including the earned income tax credit, among others. I will not focus on that at this time. I will take the opportunity to talk about what other provisions were included for economic development of the island. One of them is the opportunity zones that were included in the tax reform. And we achieved to have that program that Congress has extended the program basically to the 100% of the island. That means that we are exempted from the U.S. to the standard review or for the certification process in the Treasury. And we are not subject to the 25% cap for investment. Using the census tracts that will determine who will qualify or not. The second area that we included in the tax reform was the rum tax go-over. That area was expired in 2016, so we managed to include a retroactive application of the rum tax that gave us more than $900 million for Puerto Rico and the U.S. Virgin Islands. We are the two rum producers, biggest producers in the nation, so Puerto Rico and the Virgin Islands both get $900 million. We also included an extension of Section 199 of domestic industries. That means that we receive more than $300 million in savings for domestic companies that were on the island, and that provision expired in 2016, so we managed to include it retroactively. We also passed during the last month H.R. 5869, known as the Maritime Border Security Review Act, that will give us another, option to attack terrorism and criminal threats from individuals using the Caribbean as, the border and intend to enter the United States through that border. And that will also provide to have a study of the vulnerabilities that we had in the transit zone. The transit zone will comprise not just Caribbean, but also the Pacific zone. So that bill is going to be hopefully included in the extension of the FAA bill. So we managed to secure that in the House. It passed the House, so it's going to be included there. The benefit for that is that we got, on the other hand, more than $44 billion in response from the federal government to the island after the hurricane. I think this is the fastest way the Congress has ever managed a hurricane season in Puerto Rico. Of course, Harvey, Irma, and Maria, and now Florence with a new supplemental for that. The $44 billion that we received, 21 billion of them are direct in federal support through the CDBG program, which may allow some programs to the youth and some programs for children. But most of them are going to be for housing and economic development of the island. $15 billion of them for provisions, including FEMA, disaster fund, SBA disaster loans, and HUD. That are still on the go in the island, so those programs are not finished yet. And access to the rest of them in different programs, highways, agriculture, among others. So this is not going to stop there. I mean, this is the biggest hurricane in the last 100 years, the biggest damage in 100 years. We received the biggest amount of federal funds ever, but that's not going to be enough. I mean, we need to continue to oversight what's going on, and we will need more than that for the complete recovery of the island, and that will take years. That's a 10-year investment to the island. Last week, and with this I will conclude, last week we filed the Disaster Tax Relief and Airport and Airway Extension Act that would include benefits for the employers and affected by the hurricane. Sorry, that was approved during the hurricane. And that's the reason more than $227 million are being disbursed for employers on the island that kept their employees during the difficult times, and that's boosting our economy. Right now, we're still managing a lot of the amendments and a lot of the bills that were recommended for the task force. We try to include them in several provisions that are being in front of Congress. It's the easiest way to approve them, instead of how difficult it is to get a standalone bill. So that's what we're doing. The reason I want to share this briefing with you guys, and thank you again, the Institute, for having the professionals, is that this is going to be one of the main issues of Puerto Rico here in Congress. Poverty levels, families, and we talk about families, but 46% of the island is on the poverty level rate. And of those, 80% is in women and children. So if we need to have direct measures to help this sector of the island, and that's the reason all of you are here today. So I want to thank you for having the time, and please make all the questions you want. Those are the experts, so they may help us in that way, and we're going to continue to support the NGOs and private sector to work together. And I want to thank the leadership again of this institute and all you have directly having different organizations supporting this kind of amendment. We need it. I can vote, but if we got more people involved, I mean, HR 788 is one of the versions. We filed 3 times the measure with different numbers from the CBO, the scoring, and I hope it will be included from the Senate and the House version. With that, I thank you. My Deputy Chief of Staff is here during the whole meeting, so any other question, feel free to direct to them. Thank you.
Thank you so much, Congresswoman Gonzalez. I also quickly just want to say that she will be sending out, over the next week, her office will be sending out a Dear Colleague letter for members to sign on regarding the child tax credit, so please be on the lookout for that. Given where we are on time, I think what I want to do is give Gustavo just a few minutes if you have any closing statements, and then we're going to move on to questions from the public. So as Gustavo is wrapping up his remarks, I would like for you guys to, jot down some of those questions you might have and direct them towards our panelists.
So thank you. I would just want to add briefly that, a number of elements that are crucial is to understand much better the fact that Puerto Rico is actually much more constrained in order to be able to get access to the eligible federal funding that's directed to low and moderate income families, and that in spite of that, there are a lot of opportunities to be able to make amends and make changes both at the federal level and at the local level with the support of the federal government to be able to do this. And there's, we can discuss a lot more details about that. Thank you.
All right, thank you. All right, one quick note, as we are asking questions and having the discussion, we invite you to get some snacks in the back. Please don't eat those. If not, we'll have to take them. All right, so we'll open up the floor to questions.
Maybe John has even more recent statistics on it. So yes, clearly, as one would expect, post Hurricane Maria, there's been an increase in the TANF rolls as more families have become eligible, and there actually has also been an expansion of eligibility for TANF. So yes, TANF has actually served as a mechanism to mitigate the vulnerabilities that were created by Maria. This is basically a very small lifeguard and life jacket that's being actually thrown at families, and it has to be reformed to be able to make it more effective at improving the longer term life trajectories of these families.
I want to add something to that. I'm going to answer a little bit of that question. TANF falls under the social services cap that Puerto Rico has. So there are several social programs that have a spending cap for Puerto Rico, and TANF is one of them. So Puerto Rico does not receive the same amount of funds that most states do for TANF, which is something that we are evaluating and looking at to determine if it makes sense to increase that cap at some point. But currently we do not receive the same amount.
So that's a very good question. So we actually, there's always a constraint of, what is the labor demand and what's the labor supply? And there's going to be always the issue of, is it really that there's actually low labor demand? Or is it in many cases that there's actually a mismatch between the supply that actually can be achieved and provided by low-income families and the individuals in those low-income families and the jobs available? And a lot of, what we've seen happening is that actually there's quite a bit of turnover. Even a lot of people actually get jobs, and even participants of TANF get jobs because there are work requirements for TANF. What happens in many cases is that actually people lose jobs due to turnover for a number of reasons. It might be the case that, for example, it's actually expensive for them to maintain those jobs. It's actually not worthwhile, not profitable for employers to maintain that same TANF employee, and it's better to actually turn over and get over TANF participants on the jobs. So, I would argue that actually, that's not the main issue. That yes, there is an issue of labor demand, but there's a lot of different elements that can be addressed to be able to improve the labor market outcomes of this population. For example, by improving the socio-emotional skills of these individuals to be able to maintain jobs, et cetera, and by providing them with the right skills to be able to do so.
I would like to add to that. That's what I mentioned in my talk. I think we have to have a good taxonomy of where these poor children live, because there are children that live in households where work is not possible. Maybe they are disabled parents, maybe they have some health issues and they cannot work. There are children that live in households where parents work and make very little money, and there are children that live in households where parents have been disconnected from the workforce. And what are the policies that can fix each one of those? There is no, there are different policies better fit each one of those categories. But I think that's saying that if the jobs would be there tomorrow, everybody will go and take a job. Maybe we are being naive. There is a lot of people that hasn't have a job for 5 years, for instance, maybe doesn't have the skills. So we have to think about training. We have to think other policies. So like now, there are some jobs being created at Puerto Rico with the recovery money. Would this population be able to get this job? Do they have the training that is required to get this job? So those are the things I think we have to think about.
It does not exist. There is a local policy that's intended to retain doctors in general in Puerto Rico that are it has to be certain specialties. I don't think psychiatry is one of them. So right now there's nothing like that in place.
And researchers as well.
I think also I would add what we're trying to do is focus on lay people, just regular providers of care for children, and bringing new trainings, new professional development to them to expand their ability to provide psychological first aid and basic psychosocial support, and also teach them to be able to recognize signs of trauma, what's normal in a child responding to this kind of crisis, and when should you seek additional help and support so that they can be that frontline advocate for the children. But that's very different than incentivizing them to stay. We are trying to support their growth and development and professional development. So, yes, we are, Save the Children is working with, I know in Texas we had raised the issue with the legislature there. It's not as much on the national level because sheltering usually happens through local municipalities or through, the first line it would be through the government of Puerto Rico setting those up, or through local churches, local unaffiliated organizations who open up the shelters. But so again, it would be advocacy more at that state level and at the level within Puerto Rico to institute better protection practices. When you start to talk about restricting, and there are other experts in the room who can talk more about this than I, but restricting shelter access to known sex offenders or to certain people who probably, in my opinion, would not be safe staying near or around children in particular or others, then you start to get into issues of civil liberties. And so there are only a couple of states, as far as I'm aware, who do provide separate shelter locations for people who are convicted sex offenders or pedophiles or again, different people, but it's more, very few states are doing that or taking that approach to sheltering. Most shelters are open to the general population, which means all comers. And then many states do have a policy where you have to self-identify, raise your hand on check-in to let people know that you have this history and that you probably should be, sheltered separately. But it is a very complex. It would be nice if we could help ensure that everyone in a shelter environment would be safe for the people who are staying there, but unfortunately, that hasn't been possible yet.
start. That's really the goal of the work that we're doing with El Instituto. And our plan with this work is actually to brief policymakers in Puerto Rico and here around, not only what did we learn through the work that we're doing, but what does the evidence suggest around really being able to address the issue, in this case in particular, around youth employment. Because the idea behind this was that with not only the urgency that YDI is bringing to this, but with the evidence base that suggests that we could potentially move the needle if we were to think a little bit more smartly about the kinds of interventions and the kinds of investments that we can make. Hopefully, it'll raise the visibility and motivate some change over there in terms of policy.
I would say that the organizations that serve children, that can advocate for children, have better funding. I mean, many of these organizations are really struggling, and I really welcome all the visibility that the Institute is giving to this issue, but we need more of these kind of organizations, and they are right now struggling. I think we also have to interrogate. The media have to interrogate the politicians, just straight out. I mean, in the same way that the media asks every year, what is your economic development agenda? It's like stat. I mean, those questions always happen. We have to interrogate the politicians, say, what is your agenda to reduce children poverty? It's just a basic like that.
I would add that it's not just an issue of advocacy, but I would think it's a required investment in the technocratic capacity of government to be able to implement a child development agenda, which has been lacking for many, many decades in Puerto Rico. So I think that that's of the utmost importance in order to be able to achieve any basically movement of the needle.
I also want to add, just from our work and what we've been doing, something that is crucial, and I think it's important here also at the federal level, is to continue tying the issue of child poverty and children to economic development. Because for many years, we have seen the issue of children as, a side issue. Oh, the children, we need to take care of them, and that's all true, and we all come to this work caring very deeply for children's well-being. But there's a very real implication to not tending to their needs, to not tending to the child poverty for Puerto Rico's sustainability moving forward. And so I think making that connection is one of the things that is helping gain visibility for the issue. But we still need to do a better job at it, and it can't just be the Institute speaking of it. So we ask everyone that's here also to bring that message to your advocacy organizations, to your offices, because it's the only way that we're going to get traction on this.
It hasn't been specifically studied, but it has been discussed in many panels in Puerto Rico on how this will be a problem looking forward. And it's been a problem now. It's what we called, this researcher back in the 90s, he wrote a book called The Demographic Storm. And it's happening. It's reflecting on many aspects of our lives in Puerto Rico. It's reflecting currently in labor market issues. It's reflecting specifically in the pension funds, and it's not only happening in Puerto Rico, it's happening in other places in the U.S. So they are changes that really affect the structure of many programs in and financial compromises that governments and states have.
Any more questions? All right. So I just wanted to close today by making a call to action to everyone here. We have sat here and listened and discussed a little bit about what the challenges are for children and youth, but I cannot stress enough how urgent this is for us, how urgent it is for our children, and we cannot wait another year, 2 years. There's certain issues and solutions that we have all agreed on, that we're all talking about, but we're not moving on. And so going back to the piece of the child tax credit, something like that, we are well aware that is not the only thing that's going to solve, but it is one action and also signals to families with children in Puerto Rico that we are invested in them and that we care about them and that we want them to stay and thrive there. So I ask everyone here, if you're an advocacy organization, to please add this issue on your agenda if it is not there already. If you are working for a member of Congress, to please elevate this as an issue related to Puerto Rico that needs to be given priority. And any questions, any resources that you need to support any of these asks, please feel free to come to us. Our staff is here. Brian Rosa, who's our policy manager, and Ataveira Medina, who's our director of government relations, can be great resources. So lastly, I just want to thank you for your time. Again, as I know it was a very busy day, and we will be around to answer any more questions that you have, and we're really looking forward to seeing you at another event soon. Thank you. And snacks in the